How to solve your sinus problems. Sinus problems can range from a seasonal annoyance to a painful problem that affects your daily routine. From home remedies to prescription medicines, there are numerous techniques you can try to alleviate your sinus issues. Don't suffer from sinus pain and pressure needlessly. Using natural remedies. Try rinsing with a neti pot. Warm saline water rinsed through your sinus cavity is known as nasal irrigation and can help dissolve mucus and ease nasal congestion. 1. Be sure to use clean saline water each time you use a neti pot, and disinfect it thoroughly after each use. 2. Try grapefruit seed extract supplements. If you think your sinus problems might be the result of a sinus infection, then you might benefit from taking grapefruit seed extract supplements. There is no scientific evidence that this method works, but some believe grapefruit seed extract has powerful antibiotic properties, and its high vitamin C content may help fight infection. 3. Sinus infections need to be diagnosed by a doctor. Classic symptoms include a thick, white discharge, nasal congestion, tooth discomfort, and facial pain or pressure that is made worse when the person leans forward or someone taps on his sinuses. 4. Be aware that both viruses and bacteria can cause sinusitis. Bacterial infections need to be treated with antibiotics and viruses do not respond to treatment. There is no good way to differentiate between the two, so try waiting a few days to see if the infection improves on its own or with home remedies. If not, see a doctor for treatment. Eat spicy foods. As anyone who eats spicy foods knows, enough spice can cause a runny nose. If you're experiencing congestion, try eating spicy foods to loosen and thin out the mucus in your sinuses. Cayenne pepper and horseradish are good options. 5. Use an air humidifier. Dry air causes nosebleeds and sinus pain and pressure. Invest in a humidifier for your home. For best results, you need to sit or sleep near your humidifier. Don't keep it across the room, where it won't do you any good. 6. Avoid making your home too humid, which can promote the growth of mold and dust mites, both of which are bad for people with nasal allergies. Less than 50% humidity is ideal. 7. Try nasal strips. Nasal strips are sticky cloth strips that go over the bridge of the nose and physically hold nasal passages open to relieve stuffy noses. These are available in any drugstore or convenience store. They typically come in different sizes, so choose the size that best fits your nose. Stay hydrated. Drinking water helps lubricate mucous membranes and inhaling steam helps hydrate dry nasal passages and relieve congestion. Try inhaling the steam from a hot shower or from a pot of hot water. 8. Be careful to avoid burning yourself with the steam. If you opt to use a pot of hot water, drape a towel over your head to trap the steam. This enables you to get the benefit of the steam while keeping your face far enough away from the heat source to avoid a steam burn. 9. Avoid airborne nasal irritants. Dust, pet dander, pollen, mold, and ragweed are all potential allergens. Other nasal irritants are cigarette smoke and strong perfumes or colognes. Avoid smoking and strong perfumes, and be sure to dust your home frequently to minimize indoor allergens. 10. See if your pet is the culprit. Do you tend to get congested or have a sneezing fit when you cuddle or play with your dog or cat? If you think you might be allergic to your pet, avoid letting him or her sleep with you at night and give frequent baths to reduce the buildup of pet dander. 11. Frequently vacuuming your carpets or sweeping and mopping hard floors will also help minimize the indoor allergens from your pet's fur. 12. Getting a medical diagnosis. Talk to your general practitioner. Tell your doctor what is bothering you in detail. Have you always had sinus issues or is this a new problem for you? Do you find that you feel better or worse at a certain time of the day? How are you currently finding relief? Be specific about your symptoms because the more details you provide your doctor, the better equipped they will be to help your particular condition. Other questions your doctor may ask: do you have drainage? If so, how much and how frequent? What is the color and consistency? Do you feel facial pain or fullness? Reduction or loss of smell? If any of the following are present, you may have a condition. More serious conditions than sinus congestion that needs immediate treatment: high fever, double or reduced vision, swelling around the eyes, pain when moving eyes, severe headache, stiff neck that is painful to move, or significant or recurrent nosebleeds. Have a visual inspection of your nasal cavity. Before your doctor suggests medications or other procedures, they will likely perform a visual test. Looking into your nasal passages with a lighted scope will let your doctor see any irritation or surface-level problems with your nasal passages. If necessary, your doctor may refer you to an ENT, ear, nose, and throat doctor. Take an allergy skin prick test. If your doctor recommends this test, they will prick your skin with small needles containing various allergens. If you show an allergic reaction to any of the prick points, then that will let your doctor know that you are sensitive to that particular allergen. This is helpful because it will let you know that you need to avoid pollen, for example, while you might be able to tolerate other kinds of potential allergens. 13. Have an allergy blood test. For an allergy blood test, the idea is similar to that of a skin prick test. If your doctor recommends this test, know that the key difference is that rather than pricking your skin, your doctor will draw vials of blood to test for allergen sensitivities. This test is less accurate than skin prick tests, but it is still useful and widely used. Allergy blood tests are often used in children and others who might have complications or problems with the skin prick test. 14. Undergo a CT scan. To get a clear image of what might be wrong with your sinuses, your doctor might recommend a CT scan. These scans generate an image of your sinuses, so your doctor can see if your issues are being caused by a physical problem like a deviated septum. If your doctor sees no physical problem, then they can rule out physical causes of your sinus problems. Tips. Tell your doctor about all the medicines you take, including supplements, over-the-counter, and prescription. Never mix medicines unless your doctor tells you to.